A decade ago, the UK was one of the best nations for people seeing hospital specialists in less than 4 weeks, but the latest official figures show that an estimated 7.62 million treatments are waiting to be carried out at the end of June, relating to 6.39 million patients. It's an awful lot of people and an awful lot of treatments, isn't it? Let's find out what the problem is. Alia, thank you very much for joining us. Good morning.
Good morning.
So, I suppose we all know that there's a big waiting list for pretty much everything in the NHS at the moment. There's also a kind of secondary waiting list, I think, for people who have had maybe one thing done and are waiting for something else to be done. And I'm told that's about 10 million. So if you sort of add them all together, it's almost a fifth of the population who are sort of waiting for quite a long time to get anything done.
Yeah, it's a pretty dire situation. I think, you know, many of us who work in the NHS have been expecting this for some time, and therefore we've been sort of sounding the alarm about the importance of properly funding the NHS and sort of properly staffing the NHS, which would mean that wages would need to be rethought about. And obviously we've seen over the pandemic lots of strikes, and we're seeing that continue because actually over the pandemic the situation was far worsened because obviously there was a lot of pressure. But at the same time, there was also sort of a heightened hemorrhaging of money from the NHS due to lots of corruption through sort of dodgy privatisation contracts. And we're still seeing the sort of fallout from that. You know, we've got people like Michelle Mone who owes, you know, £232 million and that hasn't been paid back. So there's lots and lots of money that continues to be lost from the NHS, and obviously patients are the ones who are going to continue to suffer.
Yeah, I mean, it's just too big, isn't it? Isn't it time that we sort of, I mean, Wes Streeting's talked about reforming the NHS and recognising that it's not working really in any way, shape or form in the way that it should. But does it need to be broken up? What's, you know, you can be throwing more money at it doesn't seem to be the answer, because, you know, people, every government that's been in for the last 20 years has put more and more money in, and it just doesn't seem to get any better.
Well, I mean, if you look at sort of the way the money has been going in and out of the NHS, it hasn't been as clear as that. And actually, we do need money to be properly funded into the NHS rather than sort of funneled out through the private sector. So it's quite unfortunate.
Yeah, but there's a lot of waste in the public sector part of it as well, isn't there?
Well, most of the waste is actually because of the private sector. Obviously, we now are working with a kind of two-tier system where people who can't afford private healthcare are using the public service, which is being broken down because actually the amount of staff that we have in the country is just one group of staff. So if you have people leaving the NHS to work in the private sector at different times of their day, then obviously the public sector isn't going to work properly. So Wes Streeting saying that they want to rely even more on the private sector is really worrying, and it's only going to break down the NHS even further. It's not going to do anything for waiting lists, it's just going to make it worse.
But people who work in the NHS and the private sector do that willingly, don't they?
Because they don't have any way to pay their rent, they don't have any way to pay their mortgage and put food on the table. I myself have worked in the NHS for many years, and I'm having to think about how to fund my life. And I don't even have children. So, you know, you have people with children, you know, up in Middlesbrough and outside of London, people are on poverty pay and they're doing nursing jobs. So actually,
what would you call poverty pay?
Well, they're getting sort of, you know, they're doing jobs around the clock and they're getting around minimum wage. They're not getting very, very good pay.
What,
and
for being nurses?
For doing nursing jobs, yeah. They're not actually qualified as nurses even, but they don't have the nurses to do the work.
But part of the problem with nursing qualifications is that nurses are now required to have a degree. And I speak to an awful lot of people who worked in the NHS many years ago when you didn't need to have a degree, and they said that forcing nurses to study for as long as they are now is a waste of money and a waste of time, and it's bad for the NHS.
I'm not really sure about the changes in sort of the way nurses train. I think a nurse's job is really difficult and it does require a lot of training. I think, you know, if...
Yeah, but it doesn't really need a degree though, does it?
I don't know. I mean, I would, you know, I've got a few degrees and I work as a psychotherapist, so I think actually it's important.
And you can't make ends meet working as a psychotherapist?
Exactly, I can't make ends meet.
How much do you get paid?
Not in the NHS. I don't get paid nearly as much as people doing half the work that I'm doing in other places in the country. So,
well, can you give me a sort of ballpark figure that you make?
I don't make very much money working in the NHS as a psychotherapist. I don't get very much more than, you know, people doing other similar jobs in the NHS, we don't get paid very much compared to people.
Well, did
who
you get a pay rise in the last round of nursing pay rises?
I didn't get a pay rise. No.
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 So why did you not get a pay rise?
Because I'm not protected by the Royal College. You know, my job is not something that is seen as something worth being paid more.
Right.
Which is really
so you're not seen as a junior doctor either?
No, I'm not. And I've probably, trained more than.
So how will you get a pay rise personally then, if you want to get a pay rise?
Well, it's not going to happen in the NHS, unfortunately, unless people start.
Well, everyone else is getting pay rises. You get junior doctors getting pay rises. The GPs are getting pay rises. Nurses are getting. Well, junior doctors have just been given 22%.
And they do really important jobs, and so do nurses. And I'm not saying that we don't, but junior doctors are having to go on strike to get money, and they're still having to fight for it. So are nurses. They've been fighting for years. We would have to do the same thing. We would have to fight really hard to get people. And that's why I'm here, really, to say, can you, there needs to be a rethinking.
But so you're saying that you need to work outside of the NHS in order to make enough money?
Yeah, I will need to look outside, and I do write, and I do things out of the NHS, yeah.
So you work in the private sector as well?
I don't work in the private sector, no.
Why not?
But I work outside of the NHS to make ends meet. Yeah, I don't work in a private company, no.
No.
That's my choice, but lots of people choose to do that.
Because but you could do it.
I could do it, of course I could. I don't want to.
Instead of saying that you haven't got enough money, why don't you get more money?
Because people in the NHS need support and they can't pay for it. They can't pay for private care. So who's going to work for them? I want to work for them.
Okay.
I want to provide care for people who can't afford it, as the NHS has been trying to do for many years. Free at the point of use is how the NHS has been informed.
Yeah, but it isn't free, is it? The point is we all pay for it. So, the fact is that a lot of waste is going on in the NHS, and as long as it's not reformed, it won't get any better. It's like I don't think it's acceptable for me to pay, say, 25% of my income tax goes to the NHS, right? And yet, I probably wouldn't be able to get an operation on the NHS without waiting for about 2 years, which is unacceptable.
Yeah, exactly. And that the concern should be people like Michelle Mone, who owe 232...
Well, Michelle Mone may owe them some money, but the budget is £200 billion a year.
£232 million is a lot of money, and she's one person.
It's a tiny amount compared to the budget of the NHS. It sounds to me that you're politically motivated, Alia. I'm sure that you mean well, but you're here because you're politically motivated, not because you're on the breadline working for the NHS, because you want to make out that you're doing terribly badly because it's all the fault of the Tories. Well, the Labour government's in now.
I'm here because I want people who can't afford to go to the private sector, unlike yourself, unlike myself, who need healthcare and can't get it. Dentistry. Now, I don't have a tooth in my mouth because I couldn't afford to go to the dentist.
You haven't got any teeth?
That money. I haven't got one tooth. I've got missing. Lots of people are going to have to not have operations, not have healthcare. I'm not here because I've got some kind of agenda other than wanting people who can't afford healthcare to be able to get healthcare. Yeah,
but you're not able to help them do it, though, are you? What can you do about it?
Well, I am here trying to help them, and I do lots of things trying to help them. I'm not sure why you've turned on me.
I'm not turned on you. I'm just pointing out that you seem to have a sort of single-minded view of the world, and you're not really willing to accept that the NHS just doesn't work because it's not very good. It's inefficient. It's badly managed. It's got too many people in it. It's got too many people working in it that don't do medical jobs as well. Would you accept that?
I think the person with the political agenda here is yourself, because, I'm talking about people who need healthcare and deserve it and, pay their taxes. Why aren't they getting it? Because there's corruption in the NHS.
No, it's not corruption. It's because it's useless. It's run badly. It's run badly by people who don't know what they're doing.
Corruption's fine. You think corruption? Fine. Who's got the political agenda here, me or you?
No, I'm not interested. I'm not interested in talking about corruption as the only source of the problem, I'm afraid. It's just not true. Thanks, Alia. Thanks for the message and thanks for everything you do for the NHS.